I'm seeing Dr. Jackie all over my For You page in regards to the comments she made about Black women, and I just want to give my 2 cents. I chose Dr. Jackie because, she's in the Atlanta area. She was a Black female doctor, and knowing like the high mortality rate with Black women during childbirth, I wanted to feel protected, so I wanted a Black doctor. But honestly, this was the most traumatic birthing experience I could have possibly thought I would have went through. To make a long story short, the day I turned 38 weeks, Dr. Jackie decided to induce me because they thought my baby had a low birth weight, meaning they thought he only weighed like 5 pounds. I went to the hospital that day not knowing that I was going to be spending the next 3 days in labor in excruciating pain. And not only was it painful for me, it was painful for my child because his heart rate was going up and down, up and down, up and down, with them trying to exhaust every option they could to get him out of me. So when all their methods failed, they ended up telling me that I had to have an emergency C-section because his heart rate had got too low. And y'all, when I tell y'all I was bawling from the moment they told me to the moment they put me on a table, crying, couldn't talk, like I couldn't even open my mouth. After that was all said and done, weighed him, he ended up being 6 pounds, 8 ounces, meaning he didn't have a low birth weight and he could have stayed in me until he was ready to come out. Mind you, in those 3 days, I didn't see Dr. Jackie one time. Not one time did I see her. And I had my baby during COVID, so it was only one person allowed in the delivery room, me and my mom, and I was scared out of my mind, okay? Scared. And then my baby, like now he has like developmental delays, and I don't know if I should associate that with them inducing me, because personally I feel like if they let him cook a little bit longer, he would have been fine. But who am I to say that's correlated? But that's just my story and I'm sticking to it, and I will not be going back.
A much needed pause to address comments that I made during a 2020 live interview with one of my castmates. First and most importantly, to Black women and mothers, including your friends, families, and the medical community who cares for you. Because my words left you hurt and feeling unsupported, I want you to know I hear you, I see you, I believe you, and I apologize from the bottom of my heart. I am brokenhearted over this. The guilt and reality that I have hurt and offended people, especially Black women, and some of my own patients, pains me to my core. As I look back over the 2-hour video again and again, I admit that I used the wrong words and descriptions to properly convey my concerns regarding maternal mortality related to women of color. But the fact is, we must do more because we are still dying more. If I could say it all over again, here's how I'd say it. When experiencing a health matter, keep a log of your concerns and symptoms so that you can provide them accurately to your physician. Have a buddy system, someone who can advocate for you when you're with a physician, especially when pregnant. Know that a second and third opinion is not just sometimes warranted, but necessary. I thank you for taking out time from your holiday to tune into my apology and my self-dedication to Black women and healthcare. I've been shaken and moved to be better.
Sometimes as African American women, we're a bit more dramatic in that you go to the doctor and you complain and you complain and you complain, and you're not taken serious because you cried wolf the entire pregnancy.
That ain't me, boo. I don't know what you're talking about, but go ahead.
I didn't say you. I just said as African American women, we want to also make sure you're being serious with your doctor and not playing the game so I can take you off work. Because then we see you 25 times in the pregnancy. It's hard to believe that there's a true problem when there's a true problem.
Remember the 2020 pandemic that hit everybody around the world? Well, Bravo wasn't filming Married to Medicine. So a lot of the ladies, including Dr. Heavenly, which is on the left, and Dr. Jackie on the right, they went to social media to continue to interact and talk to fans. And they basically talked about things associated with the show and the medical profession. So the issue is that Dr. Jackie was saying stuff like this on Married to Medicine during filming, and she continued to have the same conversation on different podcasts, like you see on Dr. Heavenly's social media thing that she was doing. They even have the StreamYard link posted for different people to come up and talk with them during the pandemic when everybody was indoors. So Dr. Jackie has on numerous occasions had somewhat of an elitist attitude when it comes to Black women. In this day and age, anytime somebody who's Black, whether they are FBA ADOS or have lineage here, like their family immigrated here or whatever, people who somewhat look down on Black people will refer to people as quote unquote African Americans. With Dr. Jackie, the issue is the reason why she's doing this apology is because most of her clientele are not just Black women, but they're more affluent Black women. So Dr. Jackie wasn't referring to her actual clients. She's referring to the clients of other people in the medical field who see women who are less privileged. So with that being said, Dr. Jackie wasn't expecting her words to really have a backlash on her because she wasn't referring to her own clientele. The women who come to see her, even if they have, let's say, 100 different problems and they're quote unquote crying wolf, she's getting paid to see these women for office visits while they're crying wolf. So the only physicians that would have an issue would be the physicians that are not really getting paid fast enough or not really getting paid a lot due to clientele who are on, let's say, government assistance or other things like that, where every office visit doesn't necessarily get you income from the client. It's possible for a doctor to see you 20 times in a month, but only get paid for the office visits that yield a treatment plan. So if you're crying wolf and you're being seen and it's just like they take your vitals, they have a conversation and that's it, the doctor may not necessarily get paid for that office visit, which is the reason why doctors don't go fishing for stuff as far as when trying to treat you. They don't run a bunch of tests to try to find a problem to fix because they might not get paid for it. But see, with Dr. Jackie, she would be more inclined to fish for stuff because the client or the patient, for the people that she's seeing, allegedly, they're all paying for everything, for every office visit. They're all paying for every treatment plan. Dr. Jackie was basically referring to poor and Black women when she was referring to this whole cry wolf, because people who are her clients and on her level, which you see in the show, they can afford to not work. Like Dr. Jackie, even though she can't have children, if she were to be pregnant and not want to work, she can afford to not work because of the level that she's on as far as income bracket. She can also outsource her clients to other people until she comes back to work. Then also she has other people who are in her office who are also working. So Dr. Jackie can afford to not work. That's the reason why she says that Black women are crying wolf and not wanting to work or to get out of work, because she's referring to Black women that more than likely are single mothers, who are broke and poor, who, even though they're married, they're check to check, so they have to work. Dr. Jackie's referring to broken, poor Black women, or women who are working class and lower, or women who just have to work. And so the most of the time, Dr. Jackie, she's unapologetic. She doesn't really care about what people say. But the issue with this is that it's more than likely people were calling her office. They were physically going to her office and boycotting. And the people who were her clientele were probably not really wanting to continue their services with her because she was getting the backlash online. That's the reason why after 3 years, the resurfaced clip from Dr. Heavenly's stream is being surfaced, because a lot of times people who are wanting to, let's just say, attack the women on the show, if they can't use stuff on the show to attack them, they'll use their social media. And that's why it took so long for this clip to surface, because some people may have clipped it or saw it, and they were kind of like sitting on it, waiting on a point in time to quote unquote attack. And it is what it is when it comes to social media. The ladies really haven't been doing content online like they were during the pandemic because they're back filming. But during that point in time, they were kind of having conversations with each other outside of the Bravo show during the pandemic. And a lot of the stuff that was said has come back to bite Dr. Jackie.
Your doctor and not playing the game so I can take you off work. Because then we see you 25 times in the pregnancy. It's hard to believe that there's a true problem when there's a true problem.
Dr. Jackie on Married to Medicine facing backlash for comments about black women who are pregnant crying wolf every time they get a chance to because they don't want to work.
I tried to tell these niggas earlier when this dumbass bitch did the dumb hoe shit.
Here's the problem that I have with Dr. Jackie. Dr. Jackie on the right there on this show, she's an OB-GYN. She helps deliver babies. Dr. Jackie has never been pregnant, or at least never had a child. So for her to critique people who have been pregnant and have come to term and have given birth, it's just a negative, especially because she's putting it towards specifically black women, not women in general. So number one, she's speaking on a situation that she has not experienced herself. And number two, she's trying to make it seem like this is a black woman problem when it shouldn't be. But if she's going to speak on it from her professional point of view, dealing with pregnant women and pregnant women coming back later on saying that they complained about a lot of stuff because they wanted to get time off from work and stuff, she needs to just focus on the people who have admitted that they did that, not all pregnant women that she's dealt with or all pregnant black women, because what we end up doing is we end up committing to anti-black racism by stating opinions that may be somewhat true, but we're doing more harm than good. We're doing more harm than good because what's going to happen is someone like Dr. Jackie going around saying this to other medical professionals, they're going to start treating pregnant black women, we'll just say in a negative way because of the stereotypes that a black woman who's never been pregnant, never had a child is putting out there. And that's going to hurt more patients who are actually experiencing stuff. Or let's say if you got a patient who's like, you know what, I do want to have time off from work. If this is what I'm telling you that I'm experiencing, then what's the big deal? I mean, you really can't prove how someone is feeling or not feeling. All you can do is run tests and say, okay, based off of what you're complaining about in these tests, here's what I could do for you. And if they don't like what you come up with, they can go to a different medical professional. That's how it should be. But just for you to put your biases out there, and I'm not gonna say she has disdain for black women, but she does, when you watch the show, she does sometimes come off as elitist. Let's go! Someone like her, with the money that she makes and the lifestyle that she lives, she can afford to just not work and be okay. Whereas someone who's like, I don't want to work like this, give me time off, they're pregnant. So if they want that, you should give it to them because they're basically caring for two people. Bias that she's putting out there, medical professionals are going to hear stuff like this, whether she says it publicly or privately, and they're going to be doing negative things to pregnant black women. I think that's just the wrong answer. The fact that she's speaking on a situation that she's never experienced herself and that she's doing anti-black racism by having it pertain to just pregnant black women. I'm not going to say she should lose her license, but I think she should take time away from the medical field and seek therapy because she may even be jealous of a lot of the pregnant women that she deals with. She may be secretly jealous, and that jealousy has turned into somewhat of a disdain. And that's the reason why she's spewing this, we'll just say, mess of saying that there's pregnant black women who are crying wolf because they want to get off from work. It shows that she wishes that she could be pregnant and she can't. This is just basically anti-black woman racism, and she's got to stop it. I think she should get a different profession, to be honest. Because if you're working with pregnant women all day and you're upset that you can't get pregnant or you can't have a kid and you're openly showing disdain, can you imagine what she's doing behind closed doors? Can you imagine the passive aggressiveness that she's putting out there when she does her medical duties every day? It's very dangerous, and I wouldn't be surprised if people come out later on and say that I had a negative experience with Dr. Jackie, and I think it's because she's jealous of me, so on and so forth. Let me know in the comment section your thoughts. thumbs up the video, share to your social media, subscribe, click the notification bell. My name is Spade. Thanks for watching. Go forth, do great things, and I'm out. Peace.